Hello all, and welcome to the L Show, where the L stands for leaning in, which means we will not shy away from any subject, no matter how taboo or uncomfortable it may be. Subjects like menopause, sex and libido, menopause, dry vagina, hot flashes, mental health and depression, which makes you not want to have sex, how we look and how we feel. I'm your host, Dr. Nicole Eastman, and am the owner of Rose Pharmacy and Boutique Apothecary located here in Cornelius. We are a compounding pharmacy with a focus on functional medicine and a much more natural approach to your health. And for those who are not familiar with what compounding is where your pharmacist makes medications that are formulated in a specific dose and or in a specific dosage form that is unique to you. And not all compounds or compounding facilities are alike. Quality shows in every aspect of what we do. You can find out more about us by checking us out on our website at roserxboutique.com or on Instagram and Facebook at Rose Pharmacy and Boutique Apothecary. And the information presented on this show does not take the place of advice from your healthcare provider and may not be suitable for all audiences. Happy Friday to all of my viewers and listeners. Hope you all are well and have had a fabulous week. So last week, during the first segment, we discussed medications that people should be cautious while taking, and also those medications that folks should not commonly be on long-term due to some of the risks associated with it. And I hope that that went over, and I hope that people got something out of it, found it helpful. Well, this segment, we are going to go back and discuss what is my favorite topic right now and also the hot topic on people's minds, and that is the world of those GLP-1s, those weight loss drugs, the Ozempic, the Wegovy, etc. And it has always been a pain point that most folks are not covered under insurance for Wegovy. But now that has been approved in the United States for heart health. So more than 3 million people with Medicare could be eligible for coverage. So that is huge. So the thing though is that some of those eligible beneficiaries could still face the out-of-pocket cost for the drug. So we're thinking about what we talked about in a few segments prior, that even though something may be covered, you still have your portion that you are going to have to pay. And something else to consider is that Medicare's budget could be highly strained as more plans decide to cover the cost of Wegovy. And they're predicting that if just 10% of the eligible population gets on this drug for a full year, the program could spend an additional net $2.8 billion. Now, that is just 10% of those eligible. Now, let's talk about the stipulations. So stipulations for Medicare Part D plans to cover Wegovy for patients, they have to be obese or overweight. They have to have a history of heart disease, and typically those things go together, but anyway, and specifically prescribe the weekly injection to reduce the risk of heart attacks and strokes. So when they're writing the prescriptions, it has to be for the reduction of the risk of heart attack and stroke. I wonder how that's going to look, though. They're going to say, okay, so next month, we're going to further reduce your risk. We're going to increase the dose. And then the following month, we're going to further increase your... So anyway, that'll be very interesting. But this would apply to about 7% of Medicare beneficiaries. And that group also makes up about 1 in 4 of the 13.7 million Medicare patients who are already obese or overweight. So, but I think that the big piece here is that this is the first time that certain Medicare beneficiaries will have access to Wegovy. But again, we think about that cost piece. Okay, they cover it, and then you still have your out-of-pocket expense. What does that look like? So what they're saying is that we're talking about people having a responsibility of greater than $300 or $400 a month while they are taking this medication. And now, of course, there are caps on insurance. When you have insurance, you have Part D or you have prescription coverage, they do have caps. In Medicare Part D specifically, for 2024, there's a $3,300 cap in out-of-pocket costs. So basically, if you're paying, say, around $400 a month for this, you hit your cap at $3,300, then at that point, it should be covered completely. However, that is just what is being said now. In 2025, the cap decreases, so you would have around $2,000 of an out-of-pocket expense with regard to this medication. But for those people, and we already know that many Medicare beneficiaries are already on limited incomes, so that is going to be something to consider. Now, something else that we have to consider is that even though the plans begin to cover, and it's not all plans are going to begin to cover it, because they have to be able to afford to cover it. So because this medication is so expensive, plans are going to have to figure out how are they going to be able to afford to cover such an expensive drug, at any portion of it at all, for their members. That's the lining that's under this. So I just say, number one, it's a good thing, good news, that we are now hearing about Medicare Part D possibly covering, many plans covering Wegovy due to the new indication of reducing heart risk and stroke. But, it's good. But the bad piece, of course, is still, what does that out-of-pocket cost look like? And then, listen, also, can you get it? So even though it may be perfect and everything goes smooth, it still becomes, where are you going to find the drug? And we know just this past week, and I say this every time I talk about this, I get hundreds of calls with regard to, do you have? And unfortunately, the answer is not always going to be yes, depending upon what that is. But again, I just wanted to put that out there. We're going to always continue to cover this very hot topic of the weight loss drugs and insurance and all of those things that people are concerned about. But remember, with compounding pharmacies, you do have options. So that's something you just want to check into, just putting that out there. Now, when we get back from break, we are going to be here with a previous guest that I had, Rachel Pritchard from CODA Wellness. She is one of the co-owners. Great. We had her on, her and her sisters, last week on the show, and it was amazing. I hope you guys go back and watch that show, but it was great. So we're going to be talking more with her about CODA Wellness and their offerings. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And if you're taking too many medications, supplements, or both, make sure that you take advantage of our consultation services, where we can help you safely solve that issue. And because I know that many folks are on those weight loss medications, specifically the popular GLP-1s, one of the other side effects that are not considered is the nutrient depletion. Rose Pharmacy now has a supplement specifically geared towards tirzepatide and semaglutide nutrient depletion. Why would you invest in a weight loss journey without maintaining the nutrients that your body needs during this time? Allow Rose Pharmacy to help make your weight loss journey, no matter where you are in the process, a more comprehensive one. Call or come to the store. Let us know you heard about us on the L Show, and we're going to give you 10% off. And as always, Rose Pharmacy, with us, there is a guarantee of what is in each and every bottle, and very few companies can offer you that. And we will see you on the other side of the break. Hello all, and welcome back to the L Show. I'm your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And if you are taking too many medications, too many supplements, or both, make sure that you take advantage of our consultation services, where we can help you safely solve that issue. And because I know that many folks are on the weight loss medications, specifically those popular GLP-1s, tirzepatide and semaglutide, one of the side effects not considered is nutrient depletion. Rose Pharmacy now has a supplement specifically geared towards terzepatide and semaglutide nutrient depletion. And why would you invest in a weight loss journey without maintaining the nutrients that your body needs during this time? Allow Rose Pharmacy to help make your weight loss journey, no matter where you are in that process, a much more comprehensive one. Call or come to the store and let us know that you heard about our weight loss support supplement on the Elle Show, and we're going to give you 10% off. And as always, I want to remind you that at Rose Pharmacy, there is a guarantee of what is in each and every bottle, and very few companies can offer you that. So today we have back on the show Rachel Pritchard. She is a nurse practitioner. She is one of the owners of CODA Wellness. Rachel, like I said, is a board-certified nurse practitioner along with her sisters Janice Smith and Stephanie Backus. They were on here before, but now I have Rachel all to myself. Thanks for coming back on the show, Rachel.
Thank you for having me. I'm so excited to be here. I had so much fun the last time.
I know.
And I'm such a big fan of yours. So thank you.
Well, thank you. Thank you.
You're welcome.
So last time I didn't feel like, and we had a great time.
We did.
We did, but I don't feel like we didn't have enough time
It's
to like
hard
cover.
to fit it all in.
Yes. So that's why we got to just go ahead, keep this baby
keep coming
moving.
back.
Keep it coming back. So, all right. The first thing I want to talk about is the sick visits. So that's something that you typically don't hear from a wellness practice, right? You're not hearing it. So tell me what that looks like for you guys.
Absolutely. So this is one of the services which I can't believe I left it out last time. But yeah, we do same-day sick visits, and most of those are telehealth right now. As we've mentioned, our building is under construction, so ultimately that will roll into same-day in the building or same-day telehealth. But I think COVID got us all really comfortable with telehealth, especially for a sick visit. So that's a space that I feel very comfortable in. When I'm feeling sick, I don't want to get out of bed and go to urgent care or the ER. So to have a telehealth option, I think is really wonderful. You don't have to be an established patient with CODA. And if I ever got on a visit that I felt like somebody really needed that physical assessment, their hands or their eyes on you, we would make that clear. Another cool thing is that we are doing mobile IVs, and I do travel for those. And this is a great option for a sick person because we can really boost immunity. We can infuse you with vitamin C, zinc, replenish your fluid loss if you have that type of an illness. So yes, adding that to kind of our menu of services. Thank you for bringing it up because it's one of my favorites.
So then what if you determine somebody needs, you need to see this person, physically see this person, and they weren't going to be getting like the IV. Would you consider house call? I know that's kind of,
No, I definitely would consider it. I think it would be a case-by-case situation. Certainly if it's something that I think is more emergent, I probably would send them to the ER. Okay. But if it's something that I felt like I really want to listen to your lungs, or we're not sure, maybe you've already been on an antibiotic, it's not working, I need to really physically see you, we would come up with a plan. Or I think in telehealth, always having a backup plan. So you're stable right now, you're feeling good. These are the things that if they start to happen, call me back, and then maybe I would come and see you. Or if our intended plan isn't giving us the outcome that we expected. So as with everything at CODA, it's an individual experience. So I'll make that decision in the moment with the patient.
What about ages? So because you're coming from from primary care.
Yeah.
So talk about the age ranges, or
yeah, let's do that. I technically can see newborn through the full lifespan with my license and my training. I think a cutoff for me is that I probably wouldn't see like newborn babies on telehealth. I think that that is a situation where you should definitely have your eyes on them. But if it's a child that's probably 5 and up, can communicate for themselves, use some words to tell me how they're feeling, I can kind of see them through the screen to get an idea of what their energy level's like, what they look like. I'm definitely comfortable seeing and treating children as well.
That's great. And again, that is something it's another thing that just doesn't show in other practices.
Yeah.
So you guys just have
I appreciate that.
many things.
I appreciate that. And I think as a family care provider, you're trained for that. We see anything that comes through the door, and we see any age that comes through the door. And you learn what you know, what you don't know, what your boundaries are, what you're comfortable with. And if I ever for a moment thought it was a child that needed more, I would, of course, say so.
Okay, so I'm going to throw a little curveball at you
Do
real
it.
quick. So why do you think that other wellness clinics don't do, because many of them, are run by nurse practitioners and things like that, right? And so why do you think other places don't offer them?
I think it's a lot of work. I mean, let's say being a nurse practitioner and owning a business is a lot of work, period.
Yeah.
But it is difficult sometimes to know a little bit about everything versus really specializing and being an expert in one thing. And I think that it's a lot of work to not know what's going to come in the door. But my primary care background trained me for that. Had I maybe chosen a specific avenue right after school or went into a certain specialty of care that I was just going to be endo or just be hormones or just be a naturopath or wellness, it would be harder to expand out of that afterwards. But I think because I was just kind of thrown into everything, that's where I'm comfortable. And so now it's almost impossible for me to not think about the whole person, the whole body, or the whole system because they're all so closely connected. So it was also really difficult in primary care when you're like, this person's handling this person's handling this. Not everybody's communicating. Some of those things are working against each other. And so my practice just naturally developed into kind of going, everything's interconnected head to toe. And it's hard for me to now not think about the person in total wellness, total head to toe. I hope that answers the question.
No, it does. It does. And I was thinking, as I was asking the question, I said to myself, I think it's probably because of the work, just all that goes into it.
And it's hard not to. Like if I'm talking to somebody about hormones or something else, so many other things contribute to that. So to just stay so focused and in that lane, and I can, if people want me to, I can. Mm-hmm. But it's a whole body approach. And I think it probably has to do with my oncology background, my primary care background, and they're just a part of me.
Love that. Love that. So another thing before we dive into the other topic that I want to discuss. So when it's a weekend, okay, I'm not going to talk about myself.
Yes.
It's a weekend and, someone, they don't want to go to an urgent care. Mm-hmm. Could they get in contact with you on the weekend? Or is it just during the week that we do the sick visit, that sort of thing?
So right now, we probably will lie within our scheduled hours. I think when I have more staff and we grow a little bit, I would love to be able to extend that. I think a big part of what I do with my patients in wellness is, setting boundaries for yourself and really refueling and recharging yourself. I'm a mom. I have 2 young, beautiful girls. And so I do try very hard on the weekends that's their time. Mm-hmm. But I'm not saying that if somebody called with a special circumstance, it would be difficult for me to say no. But in general, the weekends are for family.
I gotcha. So maybe in the future,
absolutely,
when you get more staff, the weekends could be a possibility. But right now, we are within.
We are
Monday through Friday.
I've already though, there was a young girl, high schooler, and it was easier for her to connect with me before school to not miss school time, and so I saw her before work hours.
Okay.
So if somebody really expressed a need of we really want to connect with you, but this is our situation, I am open to that as well.
What are your typical hours, Monday through Friday?
9 to 5.
Okay. Gotcha.
Yeah. With flex. I mean, if it's an IV party, if it's, something that's going on and we plan for it, I'm able to carve out the space.
That's great. So everybody hears Monday through Friday, not weekends. Yes. And don't be calling, asking me questions on the weekend.
Right. But, we're a growing business and I'm a bleeding heart. It's hard for me. It's hard for me to say no and set boundaries. That's something that I work on, not giving so much of myself. but I also don't know really any other way.
I know.
It's a strength and a weakness, I think.
Well, when we get back, we are going to continue talking with Rachel Pritchard from CODA Wellness. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And because I know many folks out there on those weight loss medications, specifically the popular GLP-1s, tirzepatide and semaglutide, one of the side effects not considered is nutrient depletion. And Rose Pharmacy now has a supplement specifically geared towards tirzepatide and semaglutide nutrient depletion. And why would you invest in a weight loss journey without maintaining the nutrients that your body needs during this time? Allow Rose Pharmacy to help make your weight loss journey, no matter where you are in that process, a much more comprehensive one. Call or come to the store. Let us know that you heard about our weight loss support supplement on the L Show, and we are going to give you 10% off. And as always, I want to remind you that at Rose Pharmacy, there is a guarantee of what is in each and every bottle, and very few companies can offer you that. And we will be right back with Rachel Pritchard of CODA Wellness. See you on the other side of the break. Welcome back to the L Show. I'm your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. If you're taking too many medications, too many supplements, or both, make sure that you take advantage of our consultation services, where we can help you safely solve that issue. And because I know many folks are on weight loss medications, specifically the popular GLP-1s, which are tirzepatide and semaglutide, one of the side effects not considered is nutrient depletion. Rose Pharmacy now has a supplement specifically geared towards tirzepatide and semaglutide nutrient depletion. Why would you invest in a weight loss journey without maintaining the nutrients that your body needs during this time? Allow Rose Pharmacy to help make your weight loss journey, no matter where you are in the process, a much more comprehensive one. Call or come to the store and let us know that you heard about our weight loss support supplement on the L Show, and we are going to give you 10% off. And as always, I want to remind you that at Rose Pharmacy, there is a guarantee of what is in each and every bottle, and very few companies can offer you that. So we left off talking about the amazing CODA wellness services, one of them being the sick visits that really sets them apart. But I want to go back to something that we discussed just briefly the first time you were here, and that was gender affirming care.
Yes.
So first, could you tell the audience what that actually means when we say gender affirming care?
Yeah, and I'll explain it, what it means, what my role would be in it, because it means a lot of things. But what it means for CODA or for me is that I would be using hormone medications to allow people to develop sex characteristics that align with their identity. And that identity is not necessarily the sex they were assigned at birth. So in very simple terms, using estrogen to develop more female characteristics, or using testosterone to develop more male characteristics. So somebody on estrogen, we might see develop breast tissue. Somebody on testosterone, maybe they're going to get a deeper voice, some facial hair, some more defined muscle mass. And it's not that clear cut, though. I have patients who want to look and feel more feminine, look and more masculine, or sometimes that's in the middle. I have patients who are a little more fluid with their gender identity. Maybe they identify as queer and they want to kind of straddle the line between masculinity and femininity. So then we're using their natural hormones from birth and little microdoses of maybe some testosterone to kind of balance how they identify with themselves. And I think it is important, just to highlight that it's not one approach for everybody. And so it's really important that during really any session, but particularly these sessions, that the patient is really comfortable enough to share and drive the goals of the therapy.
Got you. Now, I know that you did this at your previous practice, right?
Yes.
So for how long, and how did it kind of get started at that practice?
Yeah, great question, because this is something that when I transferred to the most recent office I worked at, there was a doctor who worked there, and this was a passion of hers. And she really was passionate about building this space within our office. And she really owned that space. And I think it was really unique to the Lake area. There's a lot of places in Charlotte, but there weren't a lot up this way. So she really owned that space. And so my first kind of encounters were that she went on maternity leave. And I said I would be more than happy to see her patients while she was on maternity leave, all of her patients while she was on maternity leave. And so that was kind of my first experience in encountering a different type of hormone client that challenged me a little bit to further my learning and understanding so that I could provide competent care to her patients while she was out. And then she decided she was moving back to Boston. And this was a program she had really dedicated herself to. And so when she left, I vividly remember this office meeting, the doctor's leaving, there's, our whole team is together, other doctors, other nurse practitioners. And I said, well, what's the plan for our LGBTQ community that this doctor has so passionately grown? And it was pretty much crickets. And so that's when I decided that this was something that I needed to own a little bit more within that space, because we had really created a safe space for so many people. And I just couldn't envision people all of a sudden not having refills on their prescriptions or not having an ally or somebody in their healthcare journey. And I just decided to own that space there. And that's kind of how it all started.
Gotcha. So you decided to own that space, you alone, because you said it was crickets.
Yeah.
Why do you, and this just, why do you think that the other practitioners were like not wanting to, or maybe were not as interested in entering that space as well, or entering that to help, this continuity of care?
I, of course, don't want to speak for anybody individually, but there were a lot of conversations that happened around this. Because in that institution that I used to work for, there were some providers who, it wasn't just that they didn't want to own that space, they were actually unwilling to provide certain types of care. And this was something that kind of went down the bigger chain of like, as a provider, can you say no or deny certain types of care? And so we were able to have some really tough conversations within our practice. I think one of the reasons probably was more religious for some people. And I respect anybody's religious beliefs. I just don't always agree that medicine or your job, you get that choice necessarily. And so for me, it wasn't about my personal choice or beliefs. This was about medicine. This was about healthcare. This is about, we have patients that need a place to go. But I think it was a little political, a little bit religious, and it is taking on something new, and you are committed to furthering your education and learning, and that maybe wasn't the right time for everybody in the office to take on something new.
I think it's interesting because you brought this up. As a provider, we are here to help. We are here to take care of people. We don't get to choose the people that need help.
Correct.
Right? And so, I can see that it would just be a difficult thing for me. It would be a difficult thing to say to someone, because I don't agree with a choice or agree with your experience, because it's foreign to me. I cannot take care of your healthcare needs. That would be very difficult for me to do. And I'm certain that that's probably with you. It's not, you're not choosing,
I think it's a bigger choice to choose not to help than to choose to help. And I think we're not always made to feel that way. It's like, you're choosing to do this. I'm doing my job and I'm doing healthcare the way I know how to do it. And to say I'm not going to serve a certain population feels like a bigger choice to me than the opposite. And something that I like that you said is that it's a healthcare need. This isn't just like a choice people are coming in with.
Right.
This is like life or death for some people. This is like as big of a healthcare need as anything else that walks through my door. And so this is just the type of person I am, and this is the type of business that CODA Wellness is that we help all people. And this is no exception.
We're going to continue this conversation when we get back from break. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And if you are taking too many medications, supplements, or both, make sure that you take advantage of our consultation services where we can help you safely solve that issue. And because I know that many folks out there are on those weight loss medications, specifically the popular GLP-1s, which are tirzepatide and semaglutide, one of the side effects not considered is nutrient depletion. Rose Pharmacy now has a supplement that's specifically geared towards tirzepatide and semaglutide nutrient depletion. And why would you invest in a weight loss journey without maintaining the nutrients that your body needs during this time? Allow Rose Pharmacy to help make your weight loss journey, no matter where you are in the process, a much more comprehensive one. Call or come to the store and let us know that you heard about our weight loss support supplement on the Elle Show, and we are going to give you 10% off. And as always, I want to remind you that at Rose Pharmacy, there is a guarantee of what is in each and every bottle, and very few companies can offer you that. And we will see you on the other side of the break. Hello all. Welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. And if you are taking too many medications, too many supplements, or both, make sure that you take advantage of our consultation services where we can help you safely solve that issue. And because I know that many people are on those weight loss medications, specifically the popular GLP-1s, that is tirzepatide and semaglutide, one of the side effects not considered is nutrient depletion. Rose Pharmacy now has a supplement specifically geared towards tirzepatide and semaglutide nutrient depletion. And why would you invest in a weight loss journey without maintaining the nutrients that your body needs during this time? Allow Rose Pharmacy to help make your weight loss journey, no matter where you are in that process, a much more comprehensive one. Call or come to the store and let us know that you heard about our weight loss support supplement on the Elle Show, and we are going to give you 10% off. And as always, I want to remind you that at Rose Pharmacy, there is a guarantee of what is in each and every bottle. Very few companies can offer you that. So we left off with Rachel from CODA Wellness, and we were talking about the gender affirming care. Now we're going to stay there, and we're going to get into around ages. So the question really is, okay, what ages do you deal with? What does that look like? Kind of give me an idea of that.
I would say the majority, 95% of my historic patient population has been over the age of 18. And I actually meet patients at very different parts of their journey on where they are at in this journey. So some are just starting to explore hormone therapy for the first time, compared to people who may have already been on hormone therapy for many years and they're kind of coming in and just continuing their treatment. So it is different based on where people are starting their journey. But at the beginning of your journey, most of my patients are over 18.
Okay.
I have had a few exceptions.
I was going to ask. Yes, I was going to ask.
We've already said I live in the land of gray. Like these are the hours, but, right? So over 18, but.
Yes.
There are some things that can happen. So, of course, parental consent if you are under 18, and also that you have been established in working with a counselor or therapist who specializes in gender affirming care for about greater than 12 months, and they sign off as well. So for a minor patient, you're established with your counselor, parents are also consenting. I have had situations where hormone therapy has started under the age of 18. And I'll say these situations are never straightforward or easy in the sense of I understand these are very big choices to make, and anybody who takes hormone, these are choices to make. But this individual particularly that comes to my mind with asking the question had been living as female for many years, even though they were born male. And that's very difficult sometimes to do as you're going through puberty and developing very male characteristics when you identify as a female. And this particular patient, because their identity did not match so deeply what they felt, had really high levels of depression, bullying at school, to the point where they had to drop out of school. They were doing online schooling at home. They were very isolated, alone in their bedroom most of the day. And so in this particular situation, this is life-saving medicine, because with parental consent, with the counselor sign-off, we were able to start her on her estrogen. And watching her journey is honestly one of the most amazing things I've ever been a part of, to see a human who's clinically depressed, isolated, and alone to go to thriving, working, having relationships, having friendships. That's when there should be exceptions to the rule. So there are always exceptions, but again, the majority are over 18.
So funny. I'm changing the subject just a little bit, just a second. But when we think about hormonal therapy for women going through menopause and how we don't recognize ourselves, how we are just like, what in the heck is going on? I want to kill somebody.
Yep.
I want to jump off a bridge.
Yep.
I want to, all of those things. And then to actually go to someone who cares enough to look in deeply enough to actually look at, okay, what do we need to do? And to have you to start recognizing yourself again is just life changing. It is life changing. And I'm not saying that situation is exactly like it, but it just puts me in the mind of it, because it's like, you're like, what's wrong? What's wrong? Is there something wrong with me?
Or it's so easy for somebody to walk into your space and they're depressed, and that's all you can see. But why are they depressed? You have to look beyond it. It's not that simple. And so for women who are in menopause or a child who is transgender, it's not as simple as giving them an SSRI and calling it a day and their depression is going to be fixed.
Right.
It's deeper
than that.
Yeah. And watching that journey is one of my proudest, I think, moments. So, and I've also had other where we were counting the days until their 18th birthday. Like they came and spent their birthday with me.
Wow.
So they could start their hormone therapy.
What a testimony. I love that.
Yeah.
So what goes into this? So do you approach these patients the same way that you approach any of your other patients? Is there a difference? You know what I mean?
Yeah, I do. Okay. And I do think that I approach all of my patients with a level of compassion and understanding and hopefully safety, a good exchange of energy between two people. But I think I would be naive if I said there isn't a vulnerability to this particular patient population, depending on where they're at in their journey. And so I do think you have to approach it a little bit differently. We talk hard topics. We talk about, if you're living your life as a male, but you're female and you have female sex organs, you need a pap smear. That's not an easy conversation to always have. And that's not an always easy encounter for that patient to experience. So I do think there is a level of trust, a level of delicateness, and a level of advocacy to say, I'm willing to have a conversation that might seem uncomfortable because it's the right thing to do for my patient to make sure I'm keeping them safe across the board. And I'm also not going to claim to be an expert. So I think approaching these patients also very open, that they can also help me learn and grow. And maybe if I didn't get the language right or the terminology right, that's growth that needs to happen on my part. Or, can I use bioidenticals in transgender patients? There's not a lot of research on that. And so learning together. And I think anytime your patient trusts you and you're open and you're honest with them, and I can be transparent and say, like, I'm not an expert yet, but I'm willing to learn. Or if I don't know the answer, I'm going to go find it. So it does change your relationship, and that I think there might have to be sometimes a little more trust.
What about the procedure post this? So you've established this relationship. You had these difficult conversations.
Yeah.
Okay, we're going to move forward. Step one is what? We get labs?
Oh, full labs. Oh my gosh. Labs. Yes. So obviously we want a really good baseline of where we're starting. Sometimes we're even talking about like if certain levels are off, we're doing, brain scans of the pituitary gland, making sure that there's no other obvious hormonal disorder that needs to be corrected first, like you would with any patient. Is there anything else that's causing or in the background that needs to be corrected before we put hormones into a person's body? So yes, it's very lab heavy. And then it's very heavy the first year, especially through a transition of like monitoring your labs at 1 month, 3 months, 6 months, 9 months, and not just the sex hormone labs, but a whole bunch of other labs to make sure that your body is metabolizing your hormones, using them correctly, and that we're keeping you safe. It's very lab heavy, actually.
This is, again, I want to thank you for being a healthcare provider, for providing for all people, no matter where you are, who you are. Everyone deserves care. Everyone deserves care the way they need to be cared for, right?
I agree.
So thank you for that.
Thank you for saying that.
Yes.
That means a lot.
So, and of course, we're going to have Rachel back many more times on the show.
There are so many cool topics we can talk about.
I know. And I'm so excited about doing it.
I appreciate everybody that listens. And again, just really me getting to closing to say that everybody is welcome at CODA Wellness, and we are a safe space for all humans.
I love that.
Well, I love you. Thank you for having me on. This is great. This is so much fun. Thank you.
So if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. If you're taking too many medications, supplements, or both, make sure you take advantage of our consultation services where we can help you safely solve that issue. And because I know many folks are out there taking those popular GLP-1s, semaglutide, tirzepatide, one of the side effects not considered is nutrient depletion. Well, we have a nutrient depletion, a supplement that will assist no matter where you are in your weight loss journey. Allow Rose Pharmacy to make it plain, easy, and simple for you, and help it to be a much more comprehensive process. And if you mention that you heard about our weight loss support supplement on the show, we're going to give you 10% off. And remember, at Rose, there's a guarantee of what is in each and every bottle. Again, I want to thank all the people who have tuned in to this week's segment, and a huge thank you to Rachel for being here. Rachel, where can people learn more about CODA?
CODAWellnessNC.com is our website. You can follow us on Instagram at CODA Wellness. We are also on Facebook, CODA Wellness. Our phone number is plastered on all of those things as well. You can email us at info@CODAWellnessNC.com.
I am your host, pharmacist and owner of Rose Pharmacy and Boutique Apothecary in Cornelius. Thank you for all of those who have tuned in. We are also on Apple Podcasts and Spotify for those who missed any part of the show. Ladies, block off that 3 to 4 p.m. time slot every Friday for the Elle Show. I want this to be our happy hour where we are wrapping up a very busy week together on a very uplifting note. Thank you again, and I can't wait to spend time with you next week. Take care. Bye.